Somebody asked about your specific perspective between Costa Rica and Panama. What would you say are the biggest differences as to whether to choose between Costa Rica and Panama?
First, I'll preface it by saying you have to take individual health situations into account. If all you really need is primary care, then the edge might go to Costa Rica. The thing that you have to keep in mind, though, is when you're talking about specialists, that can swing it towards Panama. The U.S. presence here for so long means a lot of the docs here are educated in the state. Not quite as many in Costa Rica. I would say they're very close, but the deciding factor is going to be what your care requires. Do you need more specialist care? Do you need specific? And that can be, it might be tied down to maybe two docs in the country that can help what you have. And that doesn't necessarily mean to say it's an unusual condition. It's just that they're the ones who are the best at doing it. Yeah, the other thing is primary care is so important. The thing that with Costa Rica's system is that they have more care points than Panama. And I touched on that briefly. Panama's system isn't quite as well. It's not as advanced as Costa Rica. Costa Rica's primary care, they have care teams. And when you get into the Caja after 18 months of residency, you're required to get into the Caja, which is the main healthcare system, the public system. They've done a great job of having care teams, and you're assigned a care team, essentially a primary care doc, and they handle as much as they can in primary care. That is not as well organized in Panama. And in fact, if there's one thing I would change down here, I would do that in a heartbeat. Is far more focus on primary care.